I'm Dr. Raj Gopal, senior consultant in medicine as well as a cardiodiabetologist. Very happy to share my views on today's need of the hour on health status of the population, especially high blood pressure and diabetes. All of us are aware that the incidence of diabetes is increasing in the world, and India, 27% of the population are suffering from diabetes type 2. Such being the case, one has to take care of both the diabetes as well as hypertension. In diabetes, one organ is affected by the metabolic changes, which are all the organs in the body interconnected. Naturally, it affects all the organs. And in its high availability of the sugar as well as the insulin, which is the metabolic change in the body, leads to vasculitis, that is inflammation of the arterial walls inside, and that in turn lead to formation of plaques, and which results in various changes in the organs and also result in increased peripheral resistance and blood pressure. So all diabetes will ultimately turn out to have blood pressure, which is hypertension, and same is not the case reverse, that hypertension will not produce diabetes. The second thing, once it is ideal for the population at large to check at least once in a while the blood sugar to know exactly what is the state of the glycemic index in the body, and also the blood pressure, so that both are interconnected. And the normal blood pressure is for population at large is 140/90, and if you are aged 60 years and above, it is 150/90. If you found to have diabetes, it is better to have medication to see that the pressure remains less than 140/90. And if you are above the age of 60 and the pressure is high, it is better to take medicine so that prevention of development of complications is good. Number three, why these two are very important? Because the diabetes and hypertension share a common platform. They have a common connections. So it is better to take care of diabetes so that you will not result in hypertension. And the risk of, if single diabetes also produces issues, and if it is hypertension is there, the dual combination produces severe ischemia and affects the heart, affect the kidney, affect the brain, ischemic stroke. And diabetes related such as kidney diseases are becoming more common because of the less supply of the blood to the kidney. And research suggests that persistent elevated blood pressure can damage the brain cells and ultimately leads to Alzheimer's. So we have to, as human beings, should take care of ourselves in prevention and have diabetes and hypertension by following a scheduled modified diet, taking the expected diet like a lot of fresh fruits and vegetables and cereals, and avoid deep fried food, as well as restrict the sugar normally, and if you found to have diabetes, give up the sugar. Also restrict the salt. Both are to be are very important for the prevention of comorbid conditions. And make an exercise as a routine. You don't have to be a marathon runner, you don't have to be jogging, but it's better to walk briskly for at least half an hour a day. And stress-free life by meditation and yoga will definitely improve your lifestyle as well as the changes in the body. And changes in lifestyle also definitely improves the total well-being of the person. And always check your weight every week, possible at least once a month, so that it doesn't increase. And take regular blood pressure reading as well as blood sugar checkup. In nutshell, hypertension, diabetes can incredibly risky for the population, may culminate into more serious problems. So prevention is better than the cure. So take care of yourself by following the method of checking the blood pressure. It is ideal for opting for fresh fruits and vegetables instead of packaged and processed snacks and meals, selecting unsalted nuts, avoiding adding salt on the table, choosing a low sodium salt options, using spices and pickles less of salt, choosing low sodium food. So, considering the benefits, it is better to forgo and restrict the salt to a greater extent so that it leads to a healthy and good life and no development of blood pressure or its complications. Thank you.